Hello, everybody. My name is Dr. Emery Pitcel of Rothrock Chiropractic Rehabilitation. I am a chiropractic practice here in State College, Pennsylvania, and we are continuing our podcast that's called COTM, or Condition of the Month. And this month we are covering tension headache. And so, January of 2025, we're continuing on our podcast. Thank you so much for joining us. Let's dive right into it. So, what is a tension headache exactly? Well, in order to understand what's happening, it kind of helps us to explain what the anatomy is. Now, for that, I'm bringing a spine to assist along with that. What we have here is we have our cervical spine or neck. There are 7 segments up here. If we get into maybe the first 2 or 3, so the base of the skull called the occiput, the atlas, and the axis, those are kind of like your first handful of segments right there. If we have irritation to these yellow things that are called like the nerves here, the base of the skull, either of those segments, it could be irritation to the nerves, irritation that's living in the joint, or there's a draping of muscles that's along the back here that we call right in this area that we call these suboccipital muscles. Regardless of what tissue is exasperated or irritated, that could be enough to create pain perception that is picked up by the brain and then translated into a tension headache. So then classically, what do we see for the symptoms of a tension headache? Well, we're going to see first pain that tends to start in the back of the skull. So think kind of right in here, if you're pointing right to the back of your head, if you're, a female patient where you would maybe have a ponytail, or I guess you could have a man bun back in this area, but that's kind of where it's going to reside. And as it tends to get worse and worse, it's going to wrap its way up and up and up, all the way up to about the eyebrows. That's kind of usually that's most furthest extent that it gets to. So we tell people it looks a lot like a ram's horn. Imagine a ram horn kind of coming forward and then wrapping for ramming, but it's going to wrap kind of in like that. Sometimes as the symptoms start to regress and improve, we might see that then it exposes the fact that it's just like a true neck pain. But classically, that's what we're going to see with the tension type headache, is a pain that kind of goes from the back of the skull and make its way back up and forward. So next we move into this. What causes the tension type headache to get in place and to start to become a problem in the first place? Well, we have a couple of mechanism of injuries that we want to go over. First is technology. So long time spent on a computer, especially if that computer screen isn't perfectly level with the eyes to keep that neck in a nice neutral. If we're typing on a laptop or a tablet and it's down this way a little bit, that's going to keep additional strain and irritation on to those suboccipital muscles and those upper cervical segments. How about phone use? How often are we looking down at our phone, texting, or playing a video game, or playing a game that's on our tablet or on our phone? Maybe watching this very YouTube video right here down on your phone could be creating that tension type headache. We also see people that go on like long car rides or have a long day's work at the office, especially something where you're the driver. As much as we think of driving as just kind of this passive activity, the reality is there's no such thing as relaxed driving. We're always very alert, very tense, and we got to be ready to react at a split-second notice. So that's going to kind of keep us in that position that's going to continue to load that upper neck and possibly create a tension headache. Whiplash, whether that's a sports-related type injury, think of the wrestler that gets slammed to the mat, or the basketball player that takes a sideways collision that didn't see it coming. That could be enough to jar that neck out of place and create a tension headache. Um, Auto accidents, of course, or a workplace accident where something falls and maybe hits somebody on the head. Again, that's enough to create enough of a trauma force to irritate the muscle, nerve, and joint complex there. And last, we wanted to pick on poor posture. Again, we kind of alluded to like the first point, but again, just sitting in like the lecture hall, for example, or having a date night and watching some Netflix movies and having that strain set in and stay in place right there. Or could be sleep. Let's say somebody is sleeping and they don't have a proper pillow to support their neck. Maybe it's like a feather pillow or a cotton pillow that's too low, and now that neck is sitting like this, or something that's too firm and now that's propping the head up like that. All of these are going to be causes of injury that could lead to tension type headache. So, of course, that's the bad news. You have a tension type headache. Here's the good news. How can we at Rothrock Chiropractic and Rehabilitation address it? Well, much like any condition we address in here, we like to take a three-prong approach. We're going to address with rehab, we're going to do plenty of muscle work, and we're going to use our chiropractic manipulation therapies to address things. First, with the rehab, if it's a true classic tension headache that starts to wrap along this way, like we address that dull, achy, throbbing type symptoms, then there's usually going to be a McKenzie exercise that works really well. Typically, it's a held retraction to reset that joint and melt down the trigger points that live in the suboccipital muscles. And if we find that that's the directional preference, patients can really control a lot of their tension headaches just by addressing that exercise and implementing that exercise alone. In time, it's really important to go back and strengthen things to actually stabilize somebody through the shoulders so that way it's easier for them to hold that good posture, to get the deep neck flexors stronger, and to take that tension away from that upper cervical block right there. Next, the muscle therapy. These are the things that we do in office. So we really like to do pin and stretch on those suboccipital muscles. Typically, patient will be on their back and we cup those muscles and we work on helping that patient get more rotation at the neck and the skull while we really reset the input on those suboccipital and upper cervical extensor muscles. Elongate is also really nice as well too. Just long stretches and long sweeps up the length of the neck to just get tons of rich blood flow into there, reset the pain response on the muscle fibers and on the nerves to start improving that pain response. And last, being chiropractors, we love to do chiropractic manipulation therapy. However, the neck is an area that we have to slow down and be really cautious with. We do know that if we move with reckless abandonment, we could possibly compromise the vertebral or the carotid arteries. So, not everyone is a good candidate to have a neck adjustment. So, if somebody's a good candidate for a cervical manipulation, then of course we'll do those. We like to also work into the upper thoracic spine because just by addressing the function at the upper thoracic, we can gain 5 to 10% improvement of functionality in the neck just by addressing that region alone with nothing else. So it makes sense to just tackle it all as a holistic bunch. If we find or determine that we don't want to manipulate, whether that's the patient's concern, our concern, red flags from their previous medical history or family history, whatever have you, then a really good technique to use instead to address the neck for tension headaches is actually the McKenzie traction plus retraction technique, where we essentially stand at the head of the table, make a contact on the chin and the back of the head, create a lot of long traction, and then really maximally open up that space by inducing a retraction at the end of that traction movement. We actually have that video already on this channel. It's in the linked below. So if you want to watch it, feel free to click on that, please. But there you have it, a rehab, muscle therapy, and chiropractic approach. We kind of went over the anatomy of what causes the tension headache, the common symptoms that we see, mechanism of injury, and our solutions approach. Well, from us, all of us at Rothrock Chiropractic and Rehabilitation, in our January of 2025, first one for the new year, our condition of the month on tension headache, I think we could put a nice, tidy little bow on that. Thank you so much for watching until the end of the podcast. We appreciate all your support and your continued trust out there in the community. If you found this helpful, please leave a like, a comment, or subscribe to our channel. Also, pass this information along to somebody that you know is struggling with tension headaches. We'd love to be able to help you and make a really big difference in your world and get these headaches back under control. Until next time, thank you so much for watching. Take care, everybody.